We went to the hospital for what we thought was going to be an MRI for possible spine infection or something like that, meningitis, something like that for our son when he was 5. We were in the waiting room down at St. Joseph's while he was in the MRI, and he was supposed to go from the MRI, then they were going to do a lumbar puncture. He was in surgery for hours, and it was during that time, now that after the fact, I realized how important and impactful it would have been if there was somebody there, a mental health professional there for questions, comments, anything. And then when Dr. Hurry just came out, he told us it was cancer.
I think I was 28 or 29. We had a 2-year-old daughter at home, and my water broke when I was 24 weeks pregnant. So we were admitted for complete hospital bed rest until our son was born, which we had been told would just be a day or two. I ended up making it almost 9 weeks at St. Joe's, thanks to the incredible doctors and nurses. But during that entire time and our son's almost 3-week NICU stay, not only had we never even heard about mental health at that point, we definitely never met with any type of professional during our stay or soon after.
Should I try to add the bottle now, or?
What happens if he's full? Will it just come back out the tube?
These families, while they're in the hospital, especially supporting their young children, you're not thinking about yourself. You're not doing any type of preventative, maintenance for your mental health. You just want to walk out of the hospital with a healthy baby, and that was our main goal. But then you leave the hospital, and for us, every day for almost 3 months, we were told that both my and Hill's life was at risk. 24 hours a day for 9 weeks, I was worried about my life and my son's life. And you don't just leave the hospital and then that goes away. It's still with me today.
When a child receives a pediatric cancer diagnosis or any diagnosis that they might be in the hospital, the entire family actually receives that diagnosis. Everything from that moment forward is the unknown. There's nothing standard about it. You don't realize when you get that diagnosis what it's really gonna do to your family.
They give you the chemo plan. So you're basically told life is gonna be hell for the next 12 months. These are all the side effects, everything. She goes, oh, and just so you know, 80% of marriages fail when something like this happens.
Our surgeons can do a fantastic surgery. Our anesthesiologists can provide cutting-edge anesthesia seamlessly. We can provide state-of-the-art critical care support, and all of that can go very well. And then the baby goes home, and within a few years, their sibling has committed suicide. They have another sibling that is addicted to substances, and their parents are getting divorced. That's what chronic illness does to families. A lot of that's preventable. The big programs around the country have that figured out, and we do too. This is one of the few missing critical elements in our Pediatric Heart Center. This will help us catapult to the next level.
We were sat down by the doctor after another emergency MRI and told that there were no curative efforts available, that we had the choice to do more invasive radiation and brain surgery, put a shunt in, or give him death with dignity. Which is the worst choice that any parent should have to make.
There's a very large stockpile of evidence that tells us when we're in a good state of mind, when our natural endorphins are working and being released at appropriate levels, we're happy, we're not depressed, we're not anxious, we have a positive outlook, an optimistic view of our disease, then our bodies heal better. And so we can start providing therapies for the family from the outset, from the beginning of the disease. And then what will happen is we will see that they will be more confident and more capable of providing the complex care that they need to at home.
Having someone that I could just maybe even spend 90 seconds with, I think just to bring that, my confidence would have been changed a little bit, maybe a little more relaxed, and I think going back into the room, I could have listened better, been a little more attentive. I think it really could reverberate and help the whole family.
And when you're a family going through treatment, your world is rocked in every way imaginable, including financially. Your care, your mental health care, things that aren't covered by insurance fall to the back burner because you're just trying to get your children through it.
So you kick into survival mode and you make it work.
This is one of the major reasons why behavioral health gets lost in the mix, because it's so difficult for the families to navigate it on their own on the outside. Having key point people within the hospital that help get that going will make all the difference in the world.
Mental health should be a standard part of care for every patient going into a hospital.
You never know when an emergency is going to happen to someone you love. You never know if someone you love is going to end up here for a very long time, and you would want them to receive this type of treatment.
I carried a lot of shame when Finn, after he got diagnosed, and to realize and to see what these kids go through, and why I didn't do more. And I think you have to look at it like you can't change yesterday, and if there's something you can do, then do it, because it's gonna benefit somebody.